In this lecture, we are going to discuss chain of infection. Previously, when we discussed the different theories of disease occurrence, we have already mentioned the traditional model epidemiological triad, which illustrated that infectious disease result from the interaction of agent, host, and environment. So, more specifically, the transmission of the infectious agent resulted when the agent leaves its reservoir or host, whether human or animal or the soil or any other host, through a specific portal of exist. And then if the availability of suitable environment and by specific mode of transmission, it will be transmitted to human being, and then it will enter into appropriate through appropriate portal of entry and then infect susceptible host. There are some people who are susceptible for infections, and we are going to discuss that. And this is called the chain of infection, the portal of exist, mode of transmission, and portal of entry. This is called the chain of infection of different microorganisms, which may result in the occurrence of disease in a human being. So, what are we have to mention some of the terms which we are going to repeat in this lecture. For example, the reservoir. What is meant by a reservoir? The reservoir of an agent is the habitat in which the infectious agent normally lives, grows, and multiply. There are different types of reservoirs, such as human, animals, or environment, where the microorganism, the different types of microorganism, whether bacterial, virus, mycoplasma, fungal infection, parasite, the different types of microorganism where they live and grow and multiply inside the host. It called reservoir. So the reservoir may or may not be the source from which an agent is transferred to the host. For example, for Clostridium botulinum, the reservoir is the soil, but the source of most botulinum or botulism infection is improperly canned food containing Clostridium botulinum spores. So it is not necessary that the portal of the portal of exist is the same as the portal of entry. For example, as we mentioned in the poisoning of the Clostridium botulinum, the reservoir, the agent is live in the soil, but the source of infection is the canned food. Human reservoir, there are many of the common infectious diseases have human reservoirs. So the disease which are transmitted from person to person without intermediary, that means that it is the human reservoir, such as the sexually transmitted disease. Human is the only reservoir. Also measles, mumps, streptococcal infections, most of respiratory pathogens, and many others, they are transmitted from person to person. So the human is the mainly reservoir. Also, smallpox was eradicated after the last human case was identified and isolated, because humans were the only reservoir for the smallpox virus. There are two types of human reservoir. Either person with symptomatic illness, individual with the infection, and he will transmit the infection to others, or asymptomatic individuals who are called carrier. So there are two types of human reservoir: either symptomatic individual with the disease who have the disease and transmit the infection to other people, or individual who have the disease carry the microorganism, but they are asymptomatic. They have no sign and symptom of the disease, but they can transmit the disease to others. These are called carriers. So the carrier is a person without apparent disease, no sign and symptoms, but they are able to transmit the infection to or the agent to other people. So there are different types of carriers, either asymptomatic carriers who never shows sign and symptoms during the time they are infected, such as Epstein-Barr virus and cytomegalovirus, herpes simplex virus, typhoid fever, measles, or and HIV virus. So they can transmit they have no sign and symptom, they are asymptomatic, but they can transmit the infection to others. The other type is the incubatory carriers, individuals infected with certain microorganism, but in such an early stage of the disease that clinical manifestations are not apparent, but they can transmit the infection during the incubation period because the appearance of the sign and symptoms, such as in typhoid fever, hepatitis A, mumps, measles, chickenpox, most of these infections, they can transmit the infection during the incubation period and they before starting the sign and symptom. Other individuals, they such as the convalescent carriers. These are individuals who is clinically recovered from an infectious disease but still capable of transmitting the infectious agent to others. So the convalescent carrier, individuals who are recovered from the infection or the disease, but they still can excrete the microorganism and can cause infections to others. This happens with many diseases such as salmonella. Patients or individual with typhoid fever, they will continue excreting the bacteria in the feces for several weeks and rarely even for a year or more. So they will shed the microorganism for a period of time after treatment of the disease. Also, this is most common in infants and young children. Treatment with inappropriate antibiotics may prolong the convalescent carrier phase. Some infections and during infancy, especially or young children, when they are treated by inappropriate antibiotic, they will continue to shed the microorganism after finishing the treatment. A chronic carrier is one who continues to harbor an agent such as hepatitis B virus or Salmonella typhi, where the agent of typhoid fever for an extended time, months or years following the initial infection. Carriers commonly transmit disease because they do not recognize they have the infection or they are infected and consequently take no special precautions to prevent the transmission. So this is the one of the important public health significance, that the carriers, they don't show signs and symptoms, but they continue to transmit the disease to other people. So this is important in public health to identify these carrier, treat them to prevent the transmission of the disease. While symptomatic person, on the other hand, are usually less likely to transmit infection widely because their symptoms increase their likelihood of being diagnosed and treated. So they thereby reducing their opportunity for contact with other people. So also this is another important point, that symptomatic individual, he, because of the sign and symptom, he will have the treatment. So this will decrease the risk of the transmission of the infection to others. contrary to the individuals who have no sign and symptom, but they have the microorganism and they transmit the infection to other people. Other type of reservoirs are animal reservoirs. There are large number of animals who are carrying or they have the infection and they can transmit the infection to human being. And the infectious disease which are transmitted from vertebrate animal to human, it is called zoonosis. There are large number of zoonotic infection or diseases which are group of diseases which are transmitted from vertebrate animal to human by different mode of transmission. Such disease include brucellosis from cow, milk or sheep and pigs, which are diseases of animals and transmitted to human brucellosis, or it is called Malta fever or Mediterranean fever. Anthrax, it is a disease of sheep or horses, and the spores can be transmitted to human. Plague, it transmitted from rodent fleas to human. So the plague transmitted from rodent by the fleas to human. Leishmania, especially the visceral leishmania, which is transmitted from dogs to human. Rabies, which is a source, which is related or it is come from bats, raccoons, dogs, and other mammals. Also, COVID-19, which is now transmitted from bats to human. So, all these regarded as animal reservoir, which can transmit the microorganism to human. Another group of diseases with animals reservoir are those caused by viruses transmitted by insects or caused by parasites that have complex life cycle with different reservoirs at different stages of development, such as malaria. Malaria, it is one of the parasitic infection which require the mosquito to be transmitted to human, and it have different stages of their life cycle occur inside the mosquito to be infective stage, and then it will transfer the infection to human. Also schistosomiasis or bilharzia, which require the snails, special snails, and also it will develop inside the snails to develop the infective stage, which is called the cercaria. Another example is the Lyme disease. It is one of the zoonotic infection of which is transmitted from the deer, incidentally transmitted to human by a deer tick. And if the tick bite a human, so it will transfer the infection to humans. So there are large number, and you can give large number of examples of zoonotic diseases or zoonotic infections. The environmental reservoirs, plants, soil, and water in the environment are also reservoirs for some infectious agents. Many fungal agents, such as those causing histoplasmosis, live and multiply in the soil and cause infection to human. Also, the primary reservoir of Legionnaires' bacillus, as we have already discussed, which is one of the infection of the respiratory tract infection, which is mainly the source of infection is the pool of water, including those produced in the cooling tower, and it is inhaled by respiratory tract infection. Another parasitic infection, such as the hookworm or Enclistoma duodenale or toxoplasmosis, which are from the soil. Also, it is important to study or to understand the chain of infection, which we are going to start with the portal of exist, the place where or the place or the site of the exist of the microorganism. Portal of exist is the path by which an agent leaves the source host. Different type of host or reservoirs usually corresponds to the site which the agent is localized. So the port of exist, it is the portal or the starting of the chain of infection is the portal of exist, where the microorganism leaves the reservoir or the host, then is and then to find the susceptible host by special mode of transmission. For example, in tuberculosis, the tubercle bacilli and the influenza viruses exist from the respiratory tract infection of a human, or the cholera vibrio exists in the feces of infected person, or the Sacropetus scabies, which is the microorganism which causes skin infection. It is exist on the by the skin lesion and exists to infect other individual. So the portal of exist, it is variable according to the type of microorganism. So it is either respiratory tract infection or the gastrointestine, or genitourinary, such as, or the skin, or the genitourinary, such as the which is as a route for sexual transmitted diseases, including syphilis, gonorrhea, chlamydia, and HIV infection, schistosoma through the urine. Also, blood-borne agent, which we have already discussed previously, also regarded as a source of infection. For example, infection crossing the placenta from the mother to the fetus, such as rubella, syphilis, toxoplasmosis, hepatitis, and also HIV infection, while other exist by way of the skin percutaneously through cuts or needles, such as hepatitis B, or blood-sucking arthropod, or such as in malaria. The portal of exist is important for the prevention of infection. It is important to know what is the port of exist so we can control of or prevent the infection. Another part of the chain of infection is the mode of transmission. So when the infectious agent left the host, so there should be appropriate environment and there is a special mode of transmission which will cause the transmission, or the mode of transmission by which the infection transmitted to the next host. So after an agent exists the natural reservoir, it may be transmitted to a susceptible host in a numerous ways. These modes of transmission are classified either as to direct or indirect contact. The direct contact, which include direct contact or droplet spread. The indirect contact, which include airborne infection, vehicle-borne infection, and vector-borne infection, which are also divided into two types, which is the mechanical or biological, and we are going to discuss this. The direct transmission, it is essentially immediate transfer of the agent from the reservoir to a susceptible host by direct contact or by droplet spread. For direct contact occurs through the mucous membrane or skin to skin contact and sexual relationship, such as different type of sexual transmitted diseases, or by the skin contact, as we mentioned in the scabies, or different types of infections. Direct contact refers to contact with the soil or vegetation harboring infectious organism. Thus, the infectious, for example, infectious mononucleosis, which is caused by Epstein-Barr virus, or it is called, which is called the kissing disease, and gonorrhea, are spread from person to person by direct contact through a mucous membrane. Hookworm is the hookworm, or such as the Enclostoma duodenale, as we mentioned. It is one of the parasitic infection which is spread by direct contact with contaminated soil, where the cercaria of the hookworm, the larva of the hookworm is penetrate the skin directly and cause the infection to human. Droplet spread refers to the spray with relatively large, short-range aerosols produced by sneezing, coughing, or even talking, which harbor the microorganism, and it will cause the infection. And this is most of the respiratory tract infection, such as in COVID-19. It is spread by the droplet infection. Droplet spread is classified as direct because the transmission is by direct spray over a few feet before the droplet fall to the ground. Indirect transmission, and where the agent is carried from a reservoir to a susceptible host by suspended air particle or by inanimate vector or inanimate vehicle intermediary. So these types of indirect infection is caused by either by a vector, such as the vectors. Also, the vectors are either arthropod, such as mosquitoes, fleas, and ticks. These may carry the agent through the mechanical means. So there are two types of vectors, which is either mechanical or biological vector. The mechanical vector, it just carry the microorganism and transmitted without any change or development of the microorganism inside the vector. For example, the flies carry shigella on the legs, and it carry it from the source of infection to another food, for example, which on its legs, and it will cause the infection to others. So the flies carry the shigella on their legs or different types of microorganism, and take it from the source of infection and carry it on its legs, and then it transmitted to or it located on food, for example. So if a human eat that contaminated food, so it will cause the infection. The fleas carry Yersinia pestis, as we mentioned, which is the causative agent of a plague, in the gut, and deposit the agent on the skin of a new host, and it will cause the infection to a new human. So it is just carry it without any change in the or in the change in or development or multiplication inside the vector. While in so this is called the mechanical. So mechanical transmission, where the agent does not multiply or develop into further changes inside the vector. This is in contrast with the biological vector, where the microorganism or the agent undergo part of its life cycle inside the vector before being transmitted to a new host. So when the agent undergo changes within the vector is serving as both an intermediate host and mode of transmission. This type of indirect transmission is called the biological transmission, such as in malaria. For example, where the parasite of malaria and it is transmitted from human who have the disease or have the infection by the mosquito. It suck the blood which contain a specific stage of the malaria parasite. Then it will develop inside the mosquito into further stage, and then it will bite another a new host and excrete the infected blood with the new stage and will cause the disease to human. Or the same thing is for bilharzia or for schistosoma. For schistosoma, the vector is the snail, the intermediate host. When the infective the egg of the cercaria the egg of the bilharzia is excreted in the urine of infected man into the water while swimming. So the egg will find the appropriate snail and it will develop inside the snail and it will result in the cercaria, and it will leave the snail to the cercaria, leave the snail and to find a susceptible host while he is swimming in the water or in the river. So it will cause infection and penetrate the skin, and it will cause infection to human. The vehicles that may indirectly transmit an agent include food, water, or biological products, the blood, and fomites such as the inanimate objects such as the handkerchiefs or any objects which are used by the infected individual, or bedding or surgical bed sheets or clothes or surgical scalpels. All these can also transmit the infection to other individual. As with vectors, vehicles may passively carry an agent as food or water, as we mentioned, and may carry the for example, hepatitis A virus, or may provide an environment in which the agent grows or multiplies or produce toxin, as improperly canned food may provide an environment in which Clostridium botulinum produce toxin. The mode of transmission, for example, another we mentioned the airborne transmission by particles that are suspended in the air. If the infectious material is suspended in the air, so there are two types of airborne infection. There are either dust and droplet nuclei. The airborne dust includes infectious particles blown from the soil by the wind, as well as material that has settled on the surfaces and become suspended by air currents. The other one is the droplet nuclei, are the residue of dried droplets. The nuclei are less than 5 microns in size and may remain suspended in the air for long period maybe of time, and then may blown over great distances and are easily inhaled into lung and exhaled inhaled and exhaled by the individual. For example, in tuberculosis, it is believed to be transmitted more often indirectly through droplet nuclei than directly through droplet spread. As we mentioned, the Legionnaire's disease and histoplasmosis are also spread through airborne transmission. The other part of the infection chain of infection is the portal of entry. So the microorganism has portal of exist, leave the reservoir or the host, then by a specific mode of transmission, it will reach into a susceptible host, and by special portal or specific portal of entry, it will enter to a susceptible host. So the porter of entry must provide access to tissues in which the agent can multiply or a toxin can act. So often organisms use the same portal of enter a new host that they use to exist the source host. For example, in influenza virus, the port of exist is the respiratory tract infection, and by airborne infection, and it will enter the same port of entry, the same as the port of exist, such as by respiratory tract infection. So the route of transmission or the mode of transmission of the many enteric or intestinal pathogenic agent is described as a fecal-oral. So some of organisms which cause some of the gastrointestinal infection, they leave the GIT, and then also it is the portal of entry is also through the mouth by fecal-oral transmission, because the organism shed in the feces and carried on inadequately washed hands or inappropriate water supply, and then transferred through vehicles such as food or water or cooking utensils, and then to the mouth and causing a new infection in a new host. Other portal of entry include the skin directly, such as we mentioned in the hookworm and in Cholestoma duodenale, by entering the larvae directly through the skin, or the mucous membrane, such as in sexual transmitted disease, syphilis or other types of sexually transmitted disease, or trachoma or the infection of the eyes, and also by blood, such as hepatitis B. The host. The final link in the chain of infection is a susceptible host. So the starting point is the portal of exist, then mode of transmission, then port of entry, entering the susceptible host. The susceptibility of the host depends on many factors. There are many factors which makes some individuals more susceptible for certain infections rather than other individuals. First, genetic factors. An individual's genetic factors genetic makeup of the individual make him either at high risk or at lower risk because of the susceptibility. There are certain factors which make the individual more susceptible to certain infections than other people. Specific acquired immunity. The immunity of the individual, the acquired immunity, which is either by a vaccination, active vaccination, or passive vaccination, make the individual susceptible or decrease or increase susceptibility. Other genetic factors, general factors, which alter the individual's ability to resist infections or to limit pathogenicity. General factors which defend against infections include skin, mucous membrane, gastric acidity, the cilia in the respiratory tract, and cough reflex, the non-specific immune response. All these factors regarded as the natural immunity or natural defense mechanism of the body against different types of infection. General factors that may increase susceptibility are malnutrition, The nutrition is very important to increase the immunological status of the individual. That's why individuals with malnutrition, they are more liable to have infection. Alcoholism also is another factor which increases the susceptibility to infection, and disease or therapy which impairs the non-specific immune response. For example, steroid decrease the immunity of the human and increase the susceptibility of a human to disease. All these factors are affect the susceptibility of the human to infections. Specific acquired immunity refers to protective antibodies that are directed against a specific agent. Individuals have an acquired immunity. For example, the antibody which are developed from the passive immunity, which are developed from the antibody of the mother through the placenta to the baby. So the baby have acquired passive immunity. He is born with some passive immunity against certain infection, especially if the mother is immune against certain infection. The immunity, the active immunity is mainly due to the vaccination or through the infection. When any individual develop any infection, there are certain infections which resulted in long time immunity. If we attract, for example, certain infection, it will result in long life or active immunity, or by the vaccine also, it also result in immunity. But certain disease, they are occur frequently and don't result in long acting immunity. Or the acquired immunity, as we mentioned, from the mother, it will result in through the placenta. If the mother is immunized or vaccinated through certain disease, it will pass. The baby will have passive immunity. Note that the chain of infection may be interrupted when an agent does not find a susceptible host. It is important to know the chain of infection because it is important when we can interrupt this chain at different stages. And this may occur if a high proportion of individuals in the population is resistant to an agent. That's why it is important to vaccinate all the children with the specific vaccines by the schedule program. So most of the children, if they are vaccinated, so they will act as a belt, and this will prevent the occurrence of disease among some of individuals who are susceptible because they are not vaccinated. This is what is called the herd immunity. If most of the people are immune by vaccination or different types of immunity, so if they develop immunity, so they will be regarded as a belt, and they will prevent the occurrence of the infection among those individuals who are susceptible and not vaccinated. This is called the herd immunity. So the degree of herd immunity necessary to prevent or abort an outbreak varies by disease. As the time is, some of the countries, they encourage the occurrence of the epidemic or pandemic of COVID-19, that most of the people will have the infection and they will develop the immunity, and they were regarded as a belt to prevent the infection among susceptible people. In theory, herd immunity means that not everyone in the community needs to be resistant or immune to prevent the disease spread and occurrence of an outbreak. In practice, herd immunity has not prevented outbreaks of measles. That is not always the case. For example, in measles, the herd immunity did not prevent the outbreak of measles and rubella in a population with immunity level as high as 85 or up to 90%. So it is important to immunize children against this infection because of the high virulency and the high pathogenicity, and it will not protect or will not develop herd immunity against some for other susceptible children. One problem is that in highly immunized populations, the relatively few susceptible persons are often clustered in a population subgroup. So, even when we immunize most of the people by certain immunization, and if they develop immunity, but still there are some individuals remain susceptible, especially those individuals who live in low socioeconomic condition or because of the effect of certain cultural factor. So if the agent is introduced into these individuals who are susceptible, so there will develop an epidemic or an outbreak. So, what are the implications for public health? What are the implications of knowing the chain of infection for a public health physician? So, by knowing how the agent exists and enters a host and what is the mode of transmission, it is important because we can determine the appropriate control measure by knowing the mode of the exist and portal of exist and the mode of transmission and what are the portal of entry. It is we can interrupt this chain at different points and by appropriate developing of appropriate controlling measures. In general, we should direct control measures against the link in the infection chain that is most susceptible to interference. For some diseases, the most appropriate intervention may be directed at controlling or eliminating the agent at its source by treatment. For example, if we know that the individuals or human are the host or they are the source of infection, so we will treat these human or carriers to prevent the portal of exist, so no more organism will be excreted and there will be no more further infection. So in the hospital setting, patients may be treated and or isolated with appropriate either enteric precautions for GIT infections or respiratory precautions to prevent the respiratory precautions or the universal precautions that like different exit pathway. In the community, soil may be decontaminated or covered to prevent escape of the agent. If the environment, if the source of infection are soil, so we can cover or treat the soil with a special agent, so there will be no further infection. Sometimes we direct interventions at the mode of transmission. We break the chain by breaking the or prevention of the mode of transmission. For direct transmission, we may provide a treatment to the source host or educate the source host to avoid the specific type of contact associated with the transmission. In the hospital setting, since most infections are transmitted by direct contact, so it is important to always educate the healthcare provider for hand washing, frequent hand washing, or by wearing mask or wearing gloves in order to prevent the transmission of infection. For vehicle-borne transmission, it is important to decontaminate or eliminate the vehicle. For example, in hepatitis B, the infection transmitted by infected scalpel or by direct bricks or needles. So it is important to proper disposal of these materials and decontaminate disinfect the materials. For fecal-oral transmission, by prevention any infection to the gastrointestinal, especially reducing the risk by boiling appropriate water supply and appropriate food preparation in order to prevent the appropriate storage of the food, so this to decrease the risk of infection, especially by frequent hand washing. For airborne transmission, always we modify the ventilation or good ventilation. Always educate, especially those people living in poor socioeconomic condition. Always ventilation of the houses by opening the windows and prevent overcrowding, and also by putting filters or treat the air. For vector-borne transmission, usually attempts to control or reduce or eradicate the vector population by insecticide. Always, for example, in malaria, always we spray insecticide inside the houses in order to prevent or to kill the mosquito inside the houses in order to prevent the malaria. Also, we spread insecticide on the breeding sides of the mosquito in order to prevent the development of mosquito, to prevent the transmission of disease. Finally, we may apply measures that protect portal of entry of susceptible individuals by wearing masks, by wearing gloves, and also in order to protect individuals with special precautions for the spread of the infection. Also, it is important to prevent infection by prophylactic antibiotics, and vaccination are the strategies to improve the potential host defense. Certain diseases are prevented by giving a prophylactic antibiotic to the contact or to the individuals themselves. For example, in malaria, any individual traveling to endemic area of malaria, we will give him anti-malaria drug before 2 weeks before he travel, and during his travel, and 2 weeks after he return from his trip. This is to prevent the infection by certain prophylactic material, or also we can give a prophylactic material for the contact of individuals with cholera. For example, we give tetracycline for the contact, for example, and there are large number of prophylactic antibiotics to prevent infections among contacts. We have already mentioned the levels or the occurrence of the disease. We mentioned that in normal situation there should be 0 cases of any infection. There would be 0 cases. There should be no any case of a disease. 0 case of any disease. But in certain occasions, there are certain the existence of certain disease in some countries, either the existence of the disease or the microorganism at certain level, it is called endemic diseases. But the existence or the occurrence of extra number of cases more than expected potential, this is called the occurrence of an epidemic. And there are different levels of epidemics. If it occurs all over the world, it's called pandemic. So these terms, we have already discussed these terms previously. So the terms, the epidemic or pandemic, endemic or hyperendemic, we have already discussed that previously. So different diseases in different communities show different pattern of expected occurrence. So the persistent existence or occurrence of a disease in a certain place, it is called endemic level. If it is an occur in high occurrence or a high existence of the disease, it's called hyper endemic. And we have already discussed that, and we have examples of that. But the irregular pattern of occurrence of or occasional cases of certain diseases, it's called sporadic. Or if there occur an existence of cases in a certain time, it is more than expected potential, it's called epidemic. The infection, a small epidemic, it's called outbreak. The global epidemic, it is called pandemic. We have already discussed these terms before. More specifically, an epidemic may result from the following. Why? Why? What are the causes of the occurrence of epidemic? The epidemic occur when there a recent increase in amount of the agent or an increase in the virulence of agent. So any recent introduction of agent into a susceptible people, this will lead to occurrence of epidemic. Also, if there is an enhanced mode of a transmission because of certain environmental factor or because of certain behavior, so this will increase the mode of transmission and among susceptible individual and will lead to occurrence of the epidemic. Or if there are changes in the susceptibility of the host or the response to agent. For example, if the individual have low immunity because of certain drugs. So, for example, steroid individuals having or on steroid treatment, they are usually more susceptible to get infection. Or certain systemic disease such as diabetic individual, they are more liable to have infection. Or any individual on chemotherapy, they are more liable to have susceptible to infection. Or individual with malnutrition, also they are more liable to infection. And individual with malnutrition, they are not only liable to have the infection, but they are liable to have severe infection. They are liable to have severe infection. For example, measles in children, sometimes it is a mild disease and it will not cause death among not fatal among children, but in severe in individual with malnutrition, it is called severe measles and it may be fatal or at highly virulence. Factors that increase host exposure or involve introduction through new portal entry, also it is regarded as one cause of the occurrence of epidemic. There are different types of epidemic pattern or how the infection occur or spread from individuals. There are two types of epidemic, either common source epidemic or propagated epidemics. The difference between these two types, that in the common source epidemic, that the source, it is one source of epidemic and it will cause the epidemic, one source of infection. One source of infection will result in the occurrence of epidemic, and there are two types. It is either a point source epidemic or a continuous epidemic. While the propagated epidemic, there are many sources of infection. It is not the same source of infection. This is a very important difference in these two types of the epidemic. And the common source, it is on it from its name. It is common source, one source of infection which cause the epidemic. While in the propagated, there are many sources of infection. That's why it will continue of the transmission of the infection, and there are two types of propagated. The common source outbreak, when a group of persons is expected the common source outbreak when a group of individuals are exposed to one source, one common noxious influence or exposure, such as an infectious agent or toxin. So, if the group is exposed over a relatively brief period, so that everyone who becomes ill develop the disease at the end of one incubation period, then the common source outbreak is further classified into point source epidemic or point source outbreak. So we have a common source, one exposure or one source of infection. For example, if patients ate from one restaurant, the same the same restaurant give the same food for a period of time, so all the people will eat from that source, from that restaurant, so all the individual will develop gastroenteritis within the one incubation period, one exposure, one source of infection. They expose to the same source, they will develop the infection after incubation period. This is called point source outbreak. So another example is when the epidemic of leukemia cases in Hiroshima following the atomic bomb blast in Japan, because people who exposed to that bomb, so they developed leukemia after the one incubation period of leukemia. Another example is the epidemic of hepatitis among college football players of a college team. They drank contaminated water after a practice of one day, and then they develop the outbreak of hepatitis A. They drink from the same source of polluted water which contain hepatitis A virus, so they develop the sign and symptom of hepatitis after the incubation period of hepatitis A, which is from 2 weeks up to 6 weeks. When the number of cases in a point source epidemic is plotted over time, so this resulting in epidemic curve. If we plotted or we draw the number of cases regarding or distributed according to the time of occurrence of the disease, this is called an epidemic curve. Classically has in the point source epidemic, it is classically has a step up slope. It will go up and reach to a certain point of a peak, and then it gradually go down. So this is called a normal distribution curve, as it will be shown in the next slide. So the point source outbreak here, all cases appear to occur within one incubation period, suggesting that cases did not arise from person to person. There is no person to person spread, but they exposed to certain exposure and to same source of infection, and they will develop the disease at the same or during the one incubation period. So the fact that the outbreak was of short duration suggests that it was a single brief or hence point of exposure that did not persist over time. Short exposure, and it will lead to appearance of the cases within the incubation period. For example, include the example below show for example, the development of gastroenteritis or diarrhea, SEGA following the neighbor summer barbecue, or respiratory illness in worker following breakdown of a fume for hood. So from this curve, we can see the exposure is here. The exposure to the infection is here. Okay, And so the epidemic curve. First, we are going to explain the epidemic curve. This is called the epidemic curve, where on the y-axis is the number of cases or the incidence of cases, while on the x-axis is the time. This include the x-axis include the time of the occurrence of the infection. So, and these are the number of cases by time. These are the number of cases by time. This is called the epidemic curve. So the on the y-axis is the number of cases, while on the x-axis is the time. So this is the distribution of number of cases according to time of the occurrence. So by this curve, we can see here the exposure, time of exposure, then the appearance of the cases. Here the appearance of the cases. So this is regarded as the incubation period of the disease, where from the exposure till the appearance of the first cases, this is regarded as the minimum incubation period, and the last case it reflects the maximum incubation period. So the number of cases, we start in the minimum incubation period, then it increase at the peak of the incubation period, then it come down and then disappear until the last case, and it reflects the maximum incubation period of the disease. So from the epidemic curve, we can calculate the incubation period from calculating the first case until the end of the last case. So this includes the minimum and maximum incubation period of the disease. So this curve, it is called the point source epidemic, where there is one source of exposure, one source of infection. This is the exposure. This is the time where people ate the same food, for example. Then the appearance of the cases at the minimum and the maximum incubation period, it can be calculated from the curve. When the exposure, the common source infection, it can be point source or it can be continuous. When the exposure continue for a period of time, for example, in certain restaurants, if the same food is remain for 2 to 3 days or 4 days, and the people continue to eat from that food, so the appearance of cases is continue for longer period. So the exposure is here, but it continue for a period of time. So the number of cases will continue to appear until the end of the exposure. So this is the end of the incubation period here, and this is called a continuous source outbreak. So in this type of the epidemic curve, as with the point source outbreak, a group of people exposed to a single noxious influence, but here the exposure continue more or longer duration. For example, contaminated water. If the contaminated water is continued to drink for a long period of time, so this will result in a longer period of exposure. The relatively abrupt beginning of the outbreak suggests that many people were exposed simultaneously rather than it spreading via transmission from one case of another. So if you can see the spaces between the different number of cases, it is not a long period of time. So it does not reflect the incubation period between these bars, but it is not, that means there is no person to person infection, but it is because of the continuation of the exposure. The fact that no cases arise beyond one incubation period following the termination of the exposure also support the conclusion. While person-to-person spread or the propagated epidemic, this here the disease spread via person-to-person contact and the classic infectious disease pattern as it is the case now occur in the COVID-19. The infection is spread from one person to person. So that's why it is propagated from individuals, from infected individual to a susceptible individual. And this will continue in the community until all susceptible people will got the infection, then the epidemic will stop. So this is one cause of the propagation of the COVID-19. It is transmitted from one person to person, and it is propagated in the community until all susceptible will got the infection or be immunized, then it will stop. So, in person to person spread, the infection is continue to spread from one individual to another individual until all individual become immune or all susceptible individual got the infection or get immune or controlling the or having specific intervention to stop the epidemic. So the first case starting the first case which is responsible for the starting point of the infection is called the index case, which is the source of infection. Here, a single index case, for example, any individual returning a traveler, that's exactly what happened in the COVID-19. If an individual return from an infection, a place with have an epidemic or having infection, and return to another place, so and other people will arises within after the incubation period of exposure, and this will cause the infection. So the outbreak decrease or wanes when when the infected people no longer transmit the infection to other susceptible people, or when all susceptible people have the infection, or by quarantine or having certain control measure by quarantine or having treatment to individuals. This is called the propagated outbreak, where an outbreak that does not have a common source but instead spreads gradually from person to person, usually growing as spread. This is called a propagated outbreak. Usually transmission is by direct person to person contact, as by syphilis or any sexual transmitted disease, or as the case we have now as the COVID-19. The transmission may also be a vehicle-borne, as the transmission of hepatitis B or HIV virus by sharing needles among those who are a drug addict and using the same needle, or the vector-borne disease and the transmission of yellow fever by mosquito. And in a propagated epidemic, cases occur over more than one incubation period. So if we draw an epidemic curve, we can see that the separation between the bars which represent the number of cases is a period as long as the incubation period of the disease. So, in a propagated epidemic, cases occur over more than one incubation period. In theory, the epidemic curve of a propagated epidemic would have a successive series of peaks reflecting an increasing number of cases in each generation. This begins like an infection from an index case, as we mentioned, but then develops into a full-blown epidemic with secondary cases infecting new people, which is serial transmission. Primary case, which cause secondary infection, tertiary infection, and we are going to estimate the incidence rate of the index case. Then we are going to calculate the secondary incidence rate, or secondary incidence rate or attack rate, and then tertiary, and as long as the serial infection occur. This produces successively taller peaks initially separated by one incubation period, but the peaks tend to merge into waves with an increasing number of cases in a generation. So the epidemic continues until the remaining number or susceptible individuals decline or finish, or all the people got the infection or get immunized, or by certain control measure or intervention to stop the infection. So if we plot the propagated case in a propagated epidemic in a epidemic curve, this is the as we mentioned the y-axis. Here are the number of cases, and here this is the time of the occurrence of the disease, and we can see that this is the index case. Then after an incubation period, this is the first epidemic. So this individual developed the infection from the index case. This is so we can calculate the primary attack rate. Then this individuals act as a source of infection to other people. So these are the secondary cases of these cases. These cases have the infection from this one, not from this one. So they have other source of infection. It is not the same source of infection. So this is also here we can calculate the secondary attack rate. Then secondary attack rate. So and we can see that the period between the distance between the distance between different individuals is the incubation period. This is a first incubation period, and this is the second incubation period, and it also causes serial infection according to the incubation period, and the infection will stop until the end of that. All people will develop the infection, susceptible people develop the infection, or because of certain intervention. One of the important things is the investigation of an epidemic or controlling of epidemic. That is the same situation we are suffering from it now. How are we going to stop the epidemic or control the epidemic of COVID-19? The first step in investigation of epidemic or controlling the epidemic is verification